Vaccine inequality is halting Asia's pool and the rest of the world. Hong Kong CNN Business. Crowded factories in Asia's manufacturing hubs seems curiously immune to coronavirus as it spread through most of the world last year. By the end of 2020, Thailand and Vietnam had reported fewer than 200 deaths between them, and Cambodia and Laos didn't report it at all. But that changed this spring as many parts of Asia battled stubborn COVID-19 outbreaks that have infiltrated factories and other businesses critical to the global supply chain, threatening to disrupt the already strained flow of international trade. The surge in cases has forced manufacturing plants throughout the region, from Thailand, Malaysia, Vietnam, and Cambodia to China and Taiwan, to halt production while thousands of their workers get tested and quarantined. The spread of COVID in countries that had been praised for their early success in containing the virus has exposed the gaps in their vaccination rollouts, affecting vulnerable migrant workers who worked long hours in close quarters to support families back home. Mass outbreaks in major businesses are putting pressure on the workplace and straining supply just as demand is increasing around the world. The COVID cluster that have cropped up in Asia's manufacturing and transport industries differ sharply from what is happening in wealthy Western economies. The United States and Europe are celebrating a gradual return to daily life, with many triumphantly declaring the pandemic is over, even as health officials warn of the infectious Delta variant posing a possible new risk. Most U.S. adults already have at least one dose of the vaccine, and tens of thousands of shots are even going to waste. Wealthy nations have banded together to provide more resources and vaccines for poor countries battling the renewed surge. But health experts warn these efforts were not enough to vaccinate the majority of the world's population, the only way to truly end the pandemic. Around the world, many countries are now facing a surge in cases, and they are facing it without vaccines, said World Health Organization Director General Tedros Adhanom Ghebreyesus last month at a G7 media briefing in the United Kingdom. We are in the race of our lives, but it is not a fair race. Migrant workers hit hard. For nearly all of the 2020, Thailand's coronavirus cases rarely surpassed a dozen a day. Though the country experienced a mild wave this January and February, by March it had largely been contained and fell back to double digits. Then cases began climbing in April, exploding into a massive second wave that far eclipsed the first with thousands of cases a day. One 30-year-old migrant worker who contracted the virus in Thailand told CNN Business he was put into a makeshift government quarantine facility alongside children and the elderly. More than 100 workers at his factory in the country's Samut Prakan province are infected during the latest wave, he said. The man, who is from Myanmar and requested anonymity for fear of losing his job, said the facility didn't have enough food, water, and medical supplies. All the while, he and the other workers have reflected about their families and livelihoods, since they can't work or earn money in quarantine. He is one of thousands in Thailand who have been hit by factory outbreaks, where COVID has swept across the industry from seafood and electronics to clothing. Workers are at risk because they stand very close to each other, just under 2 feet apart. On assembly lines, said Sutasini Keweklai, a project manager at a migrant workers' rights network in Thailand. There are no real measures to contain the spread of the disease, she said, adding that some factories have exploited the situation by unfairly terminating employees or closing workplaces without offering compensation. She added that some workers asked their employers to arrange COVID tests, but that didn't happen. Infections are rampant. A factory for computer parts maker Car Corporation Electronics recorded more than 2,100 positive cases by the end of May among workers, more than half of whom were migrants, according to public broadcaster Thai PBS. By the end of May, Bangkok had recorded 34 separate clusters, including an ice factory and a cargo warehouse. As of Monday, the health ministry said it was monitoring 111 clusters across the country, including an air conditioner factory and garment factories. The workers in Thailand, many of whom were migrants, were for months given little protection, say activists and non-profit organizations. Thailand's vaccine rollout began in February, but for months it was only available to healthcare workers, government ministers, and other limited groups. Many of the Asian countries swept off in the outbreak haven't necessarily really gone out on the marketplace and secured adequate pre-purchased vaccines, said Stephen Morrison, Senior Vice President of the Center for Strategic and International Studies and Director of its Global Health Policy Center. And some of them, including Thailand and Malaysia, aren't eligible to receive vaccines at a low or subsidized rate from the Worldwide Vaccine Initiative, COVAX. That lack of vaccine supply combined with the devastating second wave of coronavirus in India left the region shaken really badly, Morrison said. Thailand scrambled in recent months to procure more vaccines, but it wasn't till June, as the severity of the factory clusters became clear, that the Thai government gave manufacturing workers a priority in the mass rollout that included the vaccination venues at industrial locations, according to the government official news site. The country's Prime Minister and National COVID Committee apologized June 15 for delays in supply and distribution, but the virus was already out of control. A day later, the committee disclosed that it had identified 7 new clusters, including one at a candy manufacturing company and another at a factory that makes the equipment for water supply systems. Economic blow. The outbreak in Asia may spell trouble for the global flow of trade, particularly if companies and governments can't thread the needle of controlling outbreaks while also keeping factories humming. As the world emerges from the worst of the pandemic, demand for everything from cars to electrical appliances has soared. That's already put pressure on supply chains as companies have been caught off guard by the rebound and forced to contend with the shortage of labor and critical component. Taiwan, for instance, has seen infections spread across its all-important semiconductor manufacturing sector, with more than 200 staff infected at one leading supplier. On June 7, the government launched the special vaccination program to inoculate tech workers and protect Taiwan's supplies in the global industrial chain. It struggled for months to secure vaccines, though the United States donated 2.5 million doses in late June. Semiconductor shortages predate the latest outbreak, part of the ongoing global supply crunch caused by the pandemic, extreme weather, and the surge in demand. A disruptive COVID outbreak in major chip factories could exacerbate the issue. Factory activity in some countries has already taken a dive as the COVID surge takes its toll. Manufacturing output in Malaysia and Vietnam contracted sharply in June. A survey of factory activity in Taiwan dropped from 62 in May to 57.6 in June, still above the 50-point level indicating growth from the previous month, but a sharp slowdown all the time. Thailand's reading recovered a bit, though activity is still in construction. Southeast Asia has been enormously successful in competing in the global economy, founding that niche and producing high-value goods in global supply chains, said Morrison. So, if the second wave hit and disrupted their manufacturing sectors, it knocks them back economically and has knock-on effects on the supply chain. Malaysia's manufacturing sector, for example, has seen more than 95,000 confirmed cases to date, the highest number of cases in any workplace environment, said the government news agency Bernama, citing health officials. The outbreak forced the countries back under the nationwide lockdown May 12th, but large part of the manufacturing sector were deemed essential, and employees kept working despite the rising danger, Reuters reported. The government reduced the workplace capacity during the lockdown, but the defense minister said last month their employers who forced their workers to go to work more than the 60% allowed. Still, industry leaders complained that the restrictions were too stringent. The extended lockdown period will certainly cripple the entire manufacturing sector and their contribution to global supply chains, said Tan Sri Dato So Tian Lai, president of the Federation of Malaysian Manufacturers, in the statement last month. With companies in the US and EU starting to operate all full force, it's imperative that Malaysia, as a key manufacturing hub, has to support this market as part of their global supply chains. Even as they kept working, Malaysian workers are largely unable to access vaccines. The country's vaccination rollout officially began in February, but throughout the spring, state leaders complained that the promised supply of vaccines wasn't arriving, or not in high enough amounts to cover workers, according to local media. In June, the country's Ministry of International Trade and Industry launched the vaccination program for the manufacturing sector, acknowledging that the industry was critical in supporting the supply chain of essential products and services. The global failure. Because wealthy and poor countries, including some in Asia like Singapore, have cornered the vaccines market during the initial rollout, fuller countries with scarcer resources are left with fewer options. The inequality, the disparity between the wealthy, and the low and middle income countries have been outrageous and striking, Morrison said. More than half of all high and upper middle income countries have administered enough doses to fully vaccinate at least 20% of their populations, according to Tedros, the WHO Director General. Only 3 out of 79 low and lower middle income countries, as designated by the World Bank, have reached the same level of vaccination. Morrison said the supply issue will likely ease out by the end of the year as demand eases and the surplus of vaccines builds up. But that doesn't mean the problem is solved, and it still leaves the questions of how to protect vulnerable workers in poorer countries in the short term. We have a very short window of time to get our most vulnerable protected, and we haven't done it, said Dr. Michael Ryan, the head of WHO's emergency program, during a recent press conference. As long as countries are struggling to vaccinate their populations, outbreaks may also continue cropping up and disrupting the global economy. Continued vaccine scarcity and the related threat of dangerous new viral variants are the top risk to the rebound in global economic activity and trade, said Ngozi Nkonjo-Iweala, Director General of the WTO, in April. Nobody will be safe till everyone is safe. Taiwan, Vietnam, and Thailand have enough public health care infrastructure and fiscal capacity to avoid being permanently vulnerable to devastating consequences, said Morrison. But they still need to distribute the vaccines quickly and convince their population to get the shot. A recovery will be even harder and take longer for poorer countries, including the Philippines and Cambodia, he said. Richer countries have promised greater cooperation and aid in the past month, most notably at the G7 summit, where member nations pledged more than 1 billion vaccine doses for the rest of the world, either directly or through funding to COVAX. But it's still far from enough, Tedros said after the summit. The end of the pandemic, the WHO is aiming to vaccinate at least 70% of the world's population by next year, when the G7 nations meet again. That means 11 billion doses. But only about 3 billion vaccine doses have been administered so far, mostly in high-income countries. Vaccines donated next year will be far too late for those who are dying today, or being infected today, or at risk today, Tedros said. The global failure to share the vaccines equitably is fueling the two-track pandemic that is now taking its toll on some of the world's poorest and most vulnerable people. Eric Chung contributed to this report.